What and who are Medicise South Africa?
Well, first of all, the word was actually, it's a combination of medicine and exercise. To explain to the listeners, it's a combination of how exercise is now entering medicine, and we are combining medicine and exercise. Who we are myself, obviously, but it's actually based on quite privilege to have my professor, who was back in the day at the University of Stellenbosch, Professor Barnard. He's part of the team.
Wow.
And then also I'm very privileged to have a distinguished Professor Emeritus, J. Larry Durstein from the University of South Carolina. He's also part of my team. It's a long story, but we have quite a strong academic background as well, and that's assisting us quite well.
That you might have.
Oh, yeah.
Now, just as an interesting, for people who might not know exactly what it is that you as a person do, what are your qualifications? How did you get involved in this? A lot of questions in one, but please help us to understand who you are and what you do.
So I'm a biokineticist, and we are a clinical exercise physiologist. That's what we are doing, and in South Africa, it's a unique medical profession where we combine clinical exercise testing and prescription into medicine and healthcare.
It's interesting. How did the environment change within medicine and exercise in general?
Well, if you go back into the literature, you will see that in the 1970s, it actually started when industrialization started and physical inactivity became more and more part of daily life. Gradually, we as human beings started to move less, and the physiological impact on that had a massive effect on non-communicable diseases. That's your diabetes, your heart conditions, cancer, those type of. And you'll see, if you go back into the literature from the 1970s, it has exploded up until we are where we are now. And I firmly believe that the reason why we see all these difficulties with COVID now, it's a combination with non-communicable diseases and your communicable disease.
Interesting. The other day, I had one of my presenters in my office saying that she just cannot get herself together. It's like she's got these lapses, memory lapses, a thinking process, is being, she's got problems with that, energy, etc. Tell us a bit more about your post-COVID-19 recovery program. It seems like you've got something going there that might be the solution.
Yes. So at the moment, first of all, we need to inform the listeners that we are still trying to figure out worldwide what the long-term health consequences are after COVID-19 recovery. And it seems to me, and I've got one of the literature studies here in front of me from China, from Wuhan, 6 months after the acute infection, a lot of people are still struggling with fatigue and muscle weakness, sleep difficulties, and anxiety or depression. And that's one of the major problems now that we are trying to understand, because we need to manage that. So people had COVID, and then afterwards they are actually struggling with these symptoms. Then on the other hand, you have so let me carry on where we finished. So on the other side, we've got patients that's coming out now, 6 months after hospital, but the recovery during hospital stay was more severe. And what we are seeing, and I won't go into the medical terms, here at Medicise, we're starting to see people their lungs are struggling to oxygenate the blood.
That's right.
And that means that your body is not getting enough oxygen into the bloodstream. And we need to then strengthen the physiology then from scratch so that we can restore that function. And we are actually seeing results
Wow.
Where this morning already, I had a patient who had COVID-19 symptoms, and he's busy now. It's now 7 months later, and we could restore his complete functionality.
Wow.
For me, that's quite positive. So I'm not convinced that it will be there forever, because I'm seeing in practice that patients, if you go through a proper rehabilitation program, you can actually restore.
Yes.
But yeah, so the main target of the population for us that we haven't really been exposed to much are the people that had a severe illness in hospital. Last week we saw our first patient. All those patients are now coming back into the outpatient setting. We actually have 67 various chronic disease programs at Medicise South Africa. So it's all our programs are underwritten by, to give an example, the one is American College of Sports Medicine, the other one is American Association of Cardiovascular and Pulmonary Rehabilitation, the American Thoracic Society, the American College of Chest Physicians, the American College of Cardiology, the European Society of Cardiology, and the Perioperative Exercise Testing and Training Society.
Wow.
So all our programs are well documented and well researched. It's just we brought it into the South African medical setting, where exercise is now part of medicine, and medicine is not used to that yet. But worldwide, if you go into Europe and America, we're following global trend.
I love it. Maybe some people will start exercising for the first time in their lives. You know, having gone through a life-threatening disease like this, if this does not encourage people to do it in a proper way, then I don't know. So that's why I want to ask you, what is screening before exercise testing? Just tell us a little bit how that works.
So when a patient is coming in, we don't know that patient, and we need to have a scientific overview covering all the aspects of his medical history. So screening is a scientific algorithm that's used worldwide, where we ask questions to get more information before we start the exercise, to have a much better idea of what to focus at. That also assists us to determine if a medical doctor has to be on site during the exercise test, or should we first make sure that the protocol of the exercise test, there's various protocols that depending on the intensity and the medical history. To give an example, it's either a treadmill test or bicycle test. So if someone had a knee surgery 8 months ago, they can't go onto the treadmill. We need to do the test on a bicycle. That's part of the screening process.
Wow. Wow. Now, you've mentioned a huge word. Look, I have no idea what it means, but you mentioned cardiopulmonary exercise testing. Tell us about that.
Okay, so we brought in cardiopulmonary exercise testing. It is an integrative exercise test where we, during the exercise test, we assess how the lungs, the heart, the metabolism, the amount of oxygen in the cells, and muscle strength all is working together as an integrative system. So this is very new for South Africa. I've been using this for a few years already in Europe and America, but South Africa is not informed about this at all. It's the only objective scientific comprehensive assessment that you can do on a human being to identify where are the impairments, physiological impairments during exercise.
I love the fact that we don't even know what the results in a few years. You know, when we look at the vaccines, etc., we don't know what the results are going to be in a few years to come. But if you follow this post-COVID treatment, I mean, this is something that's natural. It's just in many other ways. It's also building the body up, and especially with exercise. That's one of the most important things when it comes to being a fit person. Many people say, if you have a certain amount of fitness, you're already in a better position than what you would have been if you just a potato couch, as they call some of us. And I'm one of those. What do you do with the results of this exercise test?
So once we have the results, normally our physician on site is also part of the team where we go through the exercise testing, and then we sit down with the patient and we discuss the results of the patient, trying to identify the simplest treatment plan that the patient is in need of. And therefore, we go through the exercise results. Normally, the high risk or the patients identified at risk where there's abnormalities, for instance, during the exercise test, it's first of all, the doctor has to make the call, do we have to refer the patient back to hospital? If not, then we can start with the rehabilitation process, where the patient is then we have a cardiac rehabilitation system, where we have advanced technology from Germany, where they exercise of ECG monitoring, and we then can manipulate the intensity of the exercise program based on the results to monitor how the heart is responding during exercise until the patient is stabilized and ready to start exercising on their own.
Wow. Now, how does the process work during rehabilitation after the exercise test?
So exactly like I explained now. So once if for instance someone has to start the rehabilitation, then we have various. I won't go into a lot of detail, but after the results, it's based on heart rate zone training, what they call, and we first of all have to identify the point. We call it the anaerobic threshold, where the heart and the lungs are struggling to provide enough oxygen. And the body has to move across and start using carbohydrates as well, because the heart and the lungs are struggling to supply enough oxygen. So we identify the point on a heart rate where you exercise, and then once you go over that heart rate zone where the heart and lungs are struggling to supply enough oxygen, you go over into a new metabolic zone. And there, it's a whole scientific analysis. But once you start exercising, we normally, the high-risk patients, we keep the intensity below the anaerobic threshold. And you exercise, I call it in the green zone, where you ensure that the heart and the lungs are able to supply enough oxygen.
When we look at chronic disease, can exercise be used as a treatment for chronic disease in general?
Well, first of all, let me say this. Exercise, I don't think exercise will cure a disease. What we are definitely seeing, and this is based on the international recommendations, is exercise has to become part of the medical treatment package. The focus, therefore, is more managing of the disease. We're not going to get rid of the disease, but we can still manage the disease and increase quality of life. So you can live with the disease, but you can rather focus on increasing oxygen supply and increasing oxygen consumption, and your quality of life will be much higher, and you will live for a longer period where there's less complications of chronic disease.
Wow. Love this information that we're getting. I wish I can speak. We've got a few minutes left still. Lastly, how do you as a believer in Christ see your role as the founder of Medicise South Africa on planet Earth?
Well, let me put it this way. For the listeners out there, 7 years ago, I started focusing on one disease, and that was cancer. And I got this so well. I started Medicise focusing on cancer. And then the more I worked in research, I realized that there's 66 chronic diseases that are in need of exercise, prescription and testing. And then right at the end, when we were up and running, the 67th program became the most important one. And I did not plan for that. And that was COVID-19. And that for me just shows me how the Lord, back in the day, 7 years ago, he planned for COVID-19 7 years ago. But he told me back then I had to focus on cancer.
Yeah.
And then because I started trusting him and I started working onto this, he opened up a whole new world in 66 new programs. And then right at the end, he brought out this whole new world where COVID-19 was actually the main one, the 67th one. So for me, it just, what I can tell the listeners, never despise the day of small beginnings.
Yeah, amen.
The
on that
Lord
one.
will never ask you to do something
Wow.
if he does not have a plan already 7 years later. So the listener might be sitting there at home and the Lord is speaking to him now and saying, listen, you need to do something now. And it's small now, but you don't know how it will grow into in 7 years from now.
Sure.
And if you just listen to him and graft and do your work, he will open doors for you that is impossible for a human being. So for me, to answer your question, I'm very excited because I believe the Lord has kept exercise as one of his secret weapons for medicine.
Absolutely.
And the medicine does not have a clue how the human body functions. All of us, myself included, the more I work with this, the more I just see the detail how the Lord has made a human being. And there are so much information that we still have to do. There's lots more coming. I don't know what that is, but I can tell you the Lord is in control.
Yep. What can a listener do who does not have access to your facility?
Well, first of all, like Prof. Larry in the USA always tells me and all these other listeners, start walking. Start walking. Walking is the most effective exercise.
Yeah.
It's free. You can do it wherever. If you have to walk from your residing home to work, that's a blessing in disguise because your body is being assisted to increase oxygen supply and oxygen consumption. Secondly, they can, if someone has access to the internet, they can go to our website. It's www.medicisesa.co.za. They can just click there, contact us, and they can just, if they have inquiries, they can just type there and we'll get back to them.
Okay, fine. Let's just get that address going. How can listeners contact Medicise South Africa again?
So it's www.medicisesa.co.za. Or if they want to phone us, they can also phone us. It's 021 852 9793.
Okay, there we go. I'm going to just repeat that quickly. If you only grabbed your pen now, you know that this is a program where we give a lot of contact details because we want to serve our listening community. The number is 021 852 9793 or visit medicise.co.za. And it's Medicise with a C at the end.
Sorry, Wanda, it's just medicisa.co.za. We just had to, so it's the address is medicisa.co.za.
There we go. Thank you so much for that one. Hopefully everybody took notice of that now. So here we go. It's medicisa.co.za.